A trauma-informed approach is a general approach to increasing everyone's knowledge and skills around trauma. It's important to recognise this is different from trauma-specific services which directly treat trauma, such as offering trauma counselling or therapy. Trauma-informed services continually raise their awareness to recognise the impact of trauma on both themselves as staff and the people they're trying to help. They're open to being aware of the possibility of trauma in both the people being served and in the staff delivering a service. A trauma-informed approach recognises the impact of trauma and opens up a dialogue to reflect on how they could respond better if they held this in mind. This forms an ongoing process of continual learning. An easy way to remember this process for it to become part of the culture of a service is the 3 R's. So first of all, we want to recognise the impact of trauma. So that could be a particular bit of knowledge or skill. Secondly, we want to reflect on this with others and open up a dialogue about it and think, well, how does this affect us? And thirdly, we want to discuss and decide how can we respond better if we held this bit of information in mind. And that's the 3 R's, which can be a handy way in a busy service to remember building up this culture of a trauma-informed approach. Recognise, reflect and respond better. Trauma-informed care as an approach has 5 core values or principles that can help guide our reflective discussions and practice. These are to increase people's safety, choice, empowerment, to increase trustworthiness and collaboration. Regularly opening up a dialogue to discuss how we can increase putting these 5 principles into practice can create a trauma-informed culture within a service, which in turn can enable and encourage healing and recovery. Applying these 5 principles may challenge and change the way we think and work. For example, empowering people involves seeing them as people with capacities who have skills and can learn new skills. Seeing them through an asset or strengths-based lens means shifting away from models that see people primarily as passive patients or as symptoms of an illness. Empowering people can also involve increasing the level of genuine service user involvement or expert by experience involvement in how the service is delivered and developed. Another principle is working collaboratively. This can mean shifting away from thinking that we're taking care of people who are dependent on what we have to offer, and seeing people as actively and collaboratively working at their own recovery journey. This collaboration principle also means improving how we work collaboratively with other services in the wider system, other services that could become involved in supporting someone. There are a set of values and skills in an approach called co-production that can be very helpful in helping staff to work more collaboratively with other people and the people that they're trying to get alongside and help. So looking more deeply into co-production as an approach is one way to develop this principle of working collaboratively, which is one of the 5 principles of a trauma-informed approach. Trauma-informed care is an asset or strengths-based approach based on a reflective response to the impact of trauma that prioritises the physical, psychological, relational and emotional safety for both staff and the people they're offering a service to. So a principle is to try to increase safety for both staff providing a service and survivors of trauma. However, some approaches to risk can excessively take power away from people and try to control them, which can increase their risks in the longer run by giving them a strong message that they're not capable of making choices for themselves. A trauma-informed approach creates opportunities for survivors to rebuild a sense of control and empowerment, because often the original trauma involved having relatively little power, or other people exercising power over them. This can make people very sensitive to or triggered by authority figures who have power, and they may be staff in services, may be seen as an authority figure with power, who have or appear to have power over them. So hold that in mind. Thus, recovery or getting better involves someone increasing their sense of power and control over their own choices in life. And this is one of the principles of a trauma-informed approach, to increase choice and to empower people. When I read 50 recovery stories from severe mental health difficulties on the Scottish Recovery website, I was struck by one common theme that jumped out, that recovery often involved people developing more agency, a sense that they could see the decisions and actions that they took could make a difference in their life. A trauma-informed approach values and promotes the importance of genuine service user or experts by experience involvement in the development, delivery and evaluation of the services that they receive, because involvement can empower and help heal the hurts of past traumas. So reflect and think about your own practice and the practice in the service you're part of at the moment in terms of these values. Validate and say what's good about your current practice, and also say what could be done better in terms of increasing choice, trustworthiness, collaboration, safety and empowerment.